like doctor, just to start with, if you can share with our listeners, like what dental anxiety is and why it's prevalent issue among the patients.
Well, yes, that's a very good question, Avik. Um, Dental anxiety is very common and prevalent. So when I was probably 20, 21, in my very first job with dental insurance, I went to the dentist and I had a filling done, and they kept on nudging me and telling me to wake up because I was falling asleep. So I thought that that was normal, but I come to find out years later that that's not, that I'm the outlier, and most people don't fall asleep at the dentist. In fact, dental anxiety is a very real thing, and it affects the dentist the performance, and it affects everything. So the more anxious you are, for example, if you think you're going to feel pain, chances are you're more likely to feel pain. You may experience more symptoms afterwards. So the more relaxed you are, the more relaxed the dentist is, the better job he or she is able to do, and it will affect the outcome and success of the procedure and of your recovery.
Right.
Yeah. So how can we help patients relax, through all of this? There's our techniques such as breathing techniques, mindfulness. Years ago, my son and I took a mindfulness course where we went for several hours once a week for something like 10 weeks. And I was amazed at the techniques that you learn by focusing on your body and being contained and focused on the immediate and the present, just what kind of effect that has on your well-being and on your ability to control your situation. Now, your listeners might think, oh, well, that's too new age for me, and forget it. Just give me a pill, So that's acceptable too. You can contact your dentist and they can write you a prescription for some kind of anti-anxiety medication. But be aware that whatever it is, you might need to have someone accompany you to an appointment, that it may not be as safe to drive as if you weren't taking anything. There are offices that have laughing gas or nitrous oxide, and that's a great relaxant, but not every office has that. So if it's something that you need, then find a dentist that has that. For the very phobic patient, there are dental anesthesiologists. I have had patients who you can't even shake their hand without them shaking and quaking. And those people, they need to be put to sleep. So that is an option. Avoid having the dentist also be the anesthesiologist. Have a separate person come in, a qualified, trained anesthesiologist who can oversee all of that, and then plan your procedures so that everything is done in as few appointments as possible. But for the average person, distraction techniques might work. And by distraction techniques, I mean music, listening to a podcast, listening to this podcast, your podcast, Avik, or listening to books, music, watching a video, whatever it might be. Dentists too can contribute with distraction techniques. They are experts and they're trained at using distraction techniques to give an injection and with their bedside manner. One very important thing for dentists is to tell patients this is what's happening. So depending on the patient, some patients want more detail than others, and the dentist needs to be sensitive to that. But one important piece of information for all patients is, Avik, wouldn't you want to find out, yes, this particular procedure that I find uncomfortable, I want to know how long it's going to last. And that's going to help you with your mindset on what to expect. So have your dentist tell you approximately how long certain things are going to take. For
Exactly.
children, it's helpful to bring something like a stuffed animal. Bring something with you that the child can hold on to during the appointment. But parents, be careful of what you say. Comments like, "Oh, honey, you're so brave to be doing that," or "after the appointment, we're going to go and get you a toy." Well, those types of statements have subliminal messages. What they're saying to the child is, "Oh, I'm being brave, so this is something that's bad that I need to overcome." Or, "I'm going to get a toy, a reward afterwards. So that means, again, I'm doing something that's unexpected, that's beyond the everyday." And I think you want to set up your child with an expectation of lifetime expectation that visiting the dentist is a normal part of everyday life. And it's something that's not seen as a negative experience. So parents should be sensitive to that. If between two parents, there's one parent that's very nervous and the other parent that's, maybe the other parent is like me, falling asleep at the dentist, then you would have that parent bring the child, because the parent's anxiety can be conveyed to the child. So it's important with children to watch your nonverbal cues and your subliminal messages. For adult patients, when you go to the dentist, wear comfortable clothing, schedule the appointment early in the day. We've all experienced some kind of event. For me, it would be if I'm on a flight that leaves very early in the morning and I set one alarm or two alarms, and I'm still find myself waking up every hour because I'm paranoid that I'm going to oversleep and miss the flight. And that type of anxiety can translate to a dental appointment that's at 4 p.m. So at 9 a.m., 10 a.m., 11 a.m., you're worried about that appointment. So have it early in the day. In the office, there are things that the office can control. Is it too loud? Is the music too loud? Is it too warm? Tell the office so that you're comfortable there. Mm-hmm. But the most important thing is that today, dentistry can be and should be painless. So as a patient, get anesthetized, get numb. If you're not numb, tell the dentist before he or she proceeds with the procedure. I think the most important thing is to find a dentist that you have trust with, that you can have a relationship with, where you can say, "I'm nervous," or "I need this," or "I'm not numb," or whatever it is. Find a dentist that you can communicate with, because any kind of anxiety leads to less than ideal outcomes, can lead to.
Exactly. That's definitely true.